Hello, I'm going to talk to you a little bit about gestational surrogacy. This wonderful PowerPoint has been prepared by Brooke Abel, one of our very own surrogate coordinators. Now, keep in mind, this is not medical advice or prepared by a medical professional. This is our experience and should be considered only informative. So there are two types of gestational surrogacy, traditional and gestational. In traditional surrogacy, a surrogate mother is artificially inseminated either by the intended father or an anonymous sperm donor and carries the baby to term. The resulting child is therefore genetically related to both the surrogate mother and the intended father or sperm donor. So in traditional surrogacy, the surrogate is using her own egg. So there is a genetic connection to the child. In gestational surrogacy, the resulting child is not related to the surrogate mother. A gestational surrogate is often referred to as gestational carrier, but you will see the word surrogate used for both interchangeably. The key differences are traditional and gestational. Also in gestational surrogacy, the process by which gestational carrier becomes pregnant will be reviewed a little bit later. In gestational surrogacy, the embryo is created entirely by the intended parents, either by egg donors or sperm donors, but there is no genetic connection to the surrogate. The surrogate's egg is not being used. So those are the two differences, whether or not the surrogate mother is essentially the biological mother. Here at Guidance, we only work with gestational surrogacy, where there is no genetic connection between the surrogate mother or gestational carrier and the embryo. So we do not coordinate or match traditional surrogacy here at Guidance. The reason being is that traditional surrogacy is way more controversial than gestational surrogacy due to that biological tie between the surrogate and the child. It kind of, it's the borderline adoption. Depending on the state where you live. And in gestational surrogacy, the resulting child is not related to the surrogate, thus making the process legally uncomplicated. So who may consider using a gestational surrogate? There could be individuals who are struggling with infertility. That's what you see the most probably in the media. Single parents, that could be a single male or female, or however they identify. We refer to them as single parents by choice. There are also same-sex couples, as well as anyone who has concern about carrying a pregnancy to term or safely. So there's many reasons why an individual may not be able to have a healthy pregnancy, and it may not just be infertility itself due to conflicting diseases or treatment or medication they need to be on. So a little bit about the journey ahead. This is a pretty heavy slide, but we go over it with you frequently throughout the process, and we're always here to address any questions you have. So in an ideal timeline, a surrogate journey from the time of matching until there is a transfer is about 3 months. That is fairly quick. It can be slower, could be, lightning fast and a little bit quicker. But on average, it is about 3 months. There are a lot of variables that can delay that because there are so many parties involved. So you should be prepared between 3 and 6 months for a realistic process to come together, and some wiggle room in case there are any delays. So before we get into the actual journey itself, there is actually the process of signing up. So joining our program can take 1 to 2 weeks. It depends on how quickly you complete the material. It can be done in a day or within the same week. It's a matter of how quickly you run through the online education, the inquiry, the application forms, as well as to schedule your meetings with us. So that timeline is entirely up to you and how quickly you get through the materials. Once you've completed all of the intake materials and you're accepted into the program, we move to pre-screening. So pre-screening can take 1 to 2 months. This is significantly dependent on medical records. This can all be done in a week or two, but medical records can be quite a task to get your hands on. So the reason we have 1 to 2 months is collecting medical records has been known to be a lengthy process, especially if your pregnancy records are quite old. So collecting your records is probably the first thing we'd recommend anyone to do because it can be quite a task. So besides collecting your medical records, which includes your pregnancy delivery records for all your pregnancies, you also need an OB clearance letter. This is essentially a letter of recommendation from your own OBGYN saying that you are a good fit to pursue another pregnancy. You'll have to have a current PAP. If you've had an abnormal PAP, you need to have had a normal one since. There's partner education during this process where your partner is informed on their role and what to expect on the journey. There's a background check as well as an insurance review if you have insurance. Once you get through all that fun bit of information, we move to matching. And matching significantly changes based on the surrogate and where you live. Parents are looking for certain characteristics as well as location in a surrogate. So it's all about the right parents at the right time looking for someone just like you. So you do need to be a little patient with the process because we're working to find smooth, stress-free, like-minded matches so you have a positive journey. Once you are matched and you've had your meeting with the parents, there's quite a few steps in there that you can review in our FAQ. You move on to the psychological and medical screening. Psych and medical can take 1 to 2 months. This depends on how quickly the clinic schedules you and how quickly those appointments are made. So that is really entirely up to the clinic as well as sometimes your menstrual cycle. A lot of these medical appointments are time specific to where you are in your cycle. So you'll have psychological screening and medical screening. We'll go into more detail about what those include later. Once you have completed medical and psych, the results can take about 2 weeks to get, just depends on those labs and clinics to get the results in. You are then issued medical clearance. When you have medical clearance, you move on to legal. Legal can take 3 to 4 weeks. That's fairly quick. It can be slower and it can be faster. It depends on how quickly the attorneys are able to draft the contract as well as if there are any negotiations that pop up. So after execution of the contract, that's called legal clearance. And then the clinic is now able to prepare your medication calendar and you go into the active medical cycle of the journey. The medical process is about 3 to 6 weeks. We'll expand on what that means. It depends on what you're considering medical. We're approaching medical as when you start medications to when you have the transfer. But there's quite a bit medically after the transfer itself. So during medical, you're issued a medication calendar from the clinic. You have monitoring appointments locally to make sure you are responding well. There's the transfer procedure itself, as well as your post-transfer care. And then, of course, pregnancy and delivery. So it's a little bit about the timeline, and we'll break down into these a little bit further. So generally speaking, who can be a gestational carrier or gestational surrogate? It's more restrictive than you may think. Please keep in mind we are bound by and required to follow the requirements set by the ASRM, which is the American Society of Reproductive Medicine. They have guidelines and you can visit those guidelines and recommendations online. They are a wonderful resource for information on the medical, ethical requirements behind surrogacy and a lot of information on what you can expect as well. So they are always our go-to. So it's a good place to check out and become familiar with the expectations set by our overseeing medical body. So who can be a surrogate? Typically between the ages of 21 and 42. You cannot have an IUD in place at least 3 cycles before matching. You cannot have Depo-Provera at least 1 year before matching. You've had to have had a successful term pregnancy, so a healthy pregnancy and delivery. You have to have a supportive family environment. You've had to have had no more than 5 vaginal deliveries and no more than 2 previous C-sections. They will not let you do any more births other than 5 total, pretty much. You cannot be on a medication, like long-term medication that is chronic, where you cannot essentially stop it without the recommendation of a medical provider. This includes like antidepressants. So it's common, a lot of surrogates are on medication for thyroid. That is very normal and typically approved, but anything that has to do with mental health is exclusionary and disqualifying. You have to have a BMI of less than 32. We do understand that BMI isn't the best metric, but it is what is used. So it's unfortunately another rule of thumb, so it is something to be prepared for, that your BMI does have to be 32 or less. Some clinics it's 35, but I don't think I've seen someone match with a BMI over 35 or over 32. You cannot be on any government assistance. You have to have a clean criminal background check as well as your partner. You have to live in a surrogate-friendly state, which means the laws are friendly where you live, and that's something we will inform you about and help you with. You have to have a history of normal PAPs. If you've had an abnormal one, you have to have a normal one prior to your surrogacy journey. And of course, you cannot abuse or smoke. So the steps required of a surrogate to achieve medical clearance. So this is after you've matched with the family and you are getting ready to have your medical evaluation and take that next step into beginning your actual medications and transfer procedure. So of course there is a record review. We, the agency, will review your records in advance to make sure there are no red flags, as well as the intended parents IVF clinic will review your labor and delivery records as well. It does vary clinic to clinic, but we typically will catch any red flags before we even get to this step. But the clinic will always have access to your records. If everything lines up, then we are able to proceed with the medical and psychological evaluation. So the psychological evaluation will be performed on the surrogate as well as her partner or spouse. Some clinics may require a two-part evaluation. This includes the intended parents. So some clinics, mostly seen on the East Coast for some reason right now, that can easily change, require an in-person session for everybody involved. It could be the surrogate, her spouse, if that applies, and the intended parents. After psychological evaluation, you'll have your actual physical medical evaluation at the IVF clinic of the intended parents. Again, the Pap smear is normally completed beforehand. The fertility clinic does not typically do these, so that's something we have on file ready to go. At this in-person appointment, they will complete extensive blood work, including drug screening, infectious disease testing, a standard chemical panel, and your hormone evaluation. Also at this appointment is a uterine evaluation, which is an ultrasound. They'll do an ultrasound, and more commonly, they will do a saline sonogram. That is something you can definitely Google and look into to see if you're comfortable with, but that is a requirement for surrogacy. Typically, medical clearance can take 1 to 2 months, as we mentioned before. It just depends on how quickly these appointments are scheduled and how soon the results come back in. So there are a lot of variables, but we try to make this as quick as possible because this is the determining factor whether you can move forward, because this appointment is to make sure that it is a safe and healthy journey for you, as well as for the parents. After medical clearance, the clinic typically puts you on birth control pills while we wait for your legal contracts to be executed. So legal, which means you have completed all your medical appointments and you have legal clearance from the clinic. Now we enter legal contracts. The surrogate will have an attorney, and so will the intended parents. Referrals are provided and organized. This isn't something you have to navigate alone. You always have to work with a reproductive specialized attorney, though. So everyone has a representation to be their advocate during the contract stage. Typically, it starts with the intended parent's attorney drafting the contract. We, the agency, will provide the attorneys with the benefit package you agreed to at the beginning, so everybody already has a clear idea what's to be expected and what everyone's agreeing to. This helps make the process much faster and smoother. So that is where we come in as the points of contact and the mediators between all parties. Legal can take about a month. Again, it really just depends on the attorney's schedule and flexibility and how soon they can meet with you to review these contracts, as well as nothing's come up to make any changes that everyone's already agreed to. If there are negotiations that can drag out the legal process, we do our best to iron out everyone's decisions and needs prior to legal, so it can be a quick turnaround and we can address it in a timely manner. So once both parties have signed in front of a notary, this does include your partner if the surrogate is legally married. The lawyers will then issue a letter to the clinic stating that you are legally cleared, and then the clinic can take the next step to organize your medication calendar. You have reached legal clearance. How is surrogacy conception achieved? When a surrogacy, or when a natural pregnancy let me start over. When a pregnancy is conceived naturally, the body produces a variety of hormones to help prepare the uterus for conception, pregnancy, and help the embryo grow and develop. In order to achieve a successful surrogacy pregnancy, this process is recreated in the surrogate's body utilizing artificial hormones and other medications, which we'll go over in a little bit. You'll be prescribed a variety of medications to coordinate and control your cycle and ensure your uterus is ready for the embryo transfer. While there are variations in the type and amount of medicine clinics use, we will go over what you can generally expect. This is a big slide. So general medications you can expect. There are quite a few, and it is unique to each clinic. We will review a calendar in just a bit, but that calendar will vary based on your own body, potentially the intended mother's body, if she's doing an egg cycle, as well as the doctor's preference. So on the medications you can anticipate, this is a brand name. Again, some of these names will be brand or generic. You may be given something different. Lupron is the first one. Lupron prevents your natural cycle from interfering with the surrogacy process by inhibiting the secretion of hormones that control your cycle. Therefore, Lupron temporarily shuts down your ovaries to prevent ovulation, giving the fertility doctor complete control over your cycle. Lupron is typically given with birth control, and the dosage will decrease when your menstrual cycle starts. Lupron, well, all these medications, is self-administered. This one is a small subcutaneous injection, normally about a half-inch needle. All of these are very user-friendly, and the clinic will give you thorough instructions, as well as there are a lot of resources, including us, when it comes time to giving yourself these medications. The next one is estrogen. This comes in a lot of shapes and sizes. Estrogen is a hormone that is naturally produced by the ovaries to thicken your uterine lining and help maintain an early pregnancy. You'll be given estrogen early in your cycle in the form of birth control pills. You will then be given estrogen replacements about halfway through your use of Lupron, if Lupron is being used, and will continue through the 12th week of pregnancy. So yes, these medications do continue well after the transfer, but that does change specific to your doctor and the clinic and their protocol. This is when the placenta begins to take over hormone production. Estrogen will be administered by an oral tablet, or it could be a vaginal suppository, an injection, or patch applied to the skin on the abdomen. So it comes in lots of shapes and sizes and different mechanisms for absorption. So that will be specific to your doctor's preference. Lastly is progesterone. Progesterone is the hormone produced by the ovaries after ovulation. Once the uterine lining reaches the ideal thickness, your fertility doctor will prescribe you progesterone replacements to further prepare the uterus for embryo implantation. This hormone signals the uterus to begin producing the proper nutrients for the embryo. You will start taking progesterone in the days prior to the embryo transfer and continue until the 12th week of pregnancy to maintain a stable pregnancy. Remember, the 12th week is when the placenta takes over hormone production and control. Progesterone may be administered through suppositories, gels, or pills, but is typically administered via intramuscular injections. These types of injections require a bit larger of a needle. So these are some of the medications. They do come in a variety, as you can see, and you will know based on your calendar, and you will be instructed on typically your screening day on how to take these medications and how to give them to yourself, as well as we're always here to be a form of support. Here is an example of a calendar, and actually in this calendar you'll see that Lupron is not used. This is for a frozen embryo transfer, which means the embryo has been prepared, could have been recently, could be many years old, but it will be defrosted prior to the transfer, giving the family as well as the doctor a lot of flexibility in planning your journey, because you don't have to have your timing lined up with the intended mother or an egg donor. So in this calendar, you'll see that they start with baby aspirin and prenatal vitamins. This surrogate required vitamin D, which is not always the case. Not all clinics use aspirin, but all of them will require a prenatal vitamin. So you'll see that they have you start just the supplements essentially for about 2 weeks. And then about 2.5 weeks in, they'll tell you to stop taking your birth control pills. And then after that, you'll begin estrase tablet, which is an estrogen tablet. And then you see this estrogen increase in dosage and quantity over the next week. And then another week of more estrogen. And then at that last week, you see the addition of progesterone oil only about 5 days prior to the transfer. The progesterone oil is an intramuscular injection, typically. So typically given in the glute, you can do this yourself, or you can ask someone in your house to help you with that to do. But these are all very user-friendly. And then even up to the transfer, all these medications are maintained: the progesterone, the estrogen, the baby aspirin, prenatal vitamin. In this case, they did give the surrogate some antibiotics leading up to the transfer, which is pretty common as well. And this actually, they gave them something for comfort. It looks like some Valium leading up to the transfer. That's not always the case. Sometimes they do give people something for comfort or an ibuprofen of sorts, but it's not that common. So each journey is unique. The embryo transfer itself, also referred to as ET, is the process by which the embryos are placed inside the uterine cavity. The embryo is loaded into a fine, soft catheter, as you can see in this picture. Under ultrasound guidance, the catheter is advanced into the middle of the uterine cavity and the embryo is discharged. Again, you are completely conscious, awake, and you're not sedated for this procedure. It is an outpatient procedure. Probably make a note of that. The embryo transfer is usually done using 3 or 5 day embryos. That really does vary on the family, what they were able to successfully create. This means that the embryos are either 3 days or 5 days past fertilization. Sometimes it could be older, 5 or 8 days. The actual embryo transfer procedure only takes a few minutes. It's actually very quick, and it's simple and painless. You can go home within 20 minutes of the embryo transfer. Some doctors may have you lay with your feet up for an extended period of time, not too long, after the procedure. Sometimes 20 minutes, sometimes an hour. It depends on the doctor. But you do need to maintain low activity or bed rest for 24 hours after the embryo transfer to give the embryo its best shot at implanting. So you normally go back to your hotel and relax and sit with your feet up and order food and don't do anything, typically. In a few cases, parents may ask for this period of time to be extended. Occasionally, a parent will ask for a surrogate to be okay hanging out and not flying back for 2 to 3 days after the transfer. Some people don't want you rushing onto an airplane if you are traveling quickly. So they want you to rest as long as possible, and those accommodations are taken care of. So this is something to keep in mind. Afterwards, you'll have a blood HCG test, typically 2 weeks after, while medications are continued for up to 12 weeks after the transfer. So some of those fun injections and medications will continue through the early pregnancy. So from there we have the blood test, which is hopefully at this point positive and healthy. They continue that blood test until they are assured that it's a strong, healthy pregnancy. At a certain point, typically around that 12-week mark, when you are weaned off your fertility medications and you're no longer on those medications, you are no longer needed to be observed by the fertility doctor, and you transition to your own personal OBGYN or OB to take care of you for the remainder of the pregnancy. So that is the standard process. There's more questions can be addressed in our FAQ, or you can send us any questions you have. We will go over all of this with everyone frequently, and you're never left alone, and you are informed every step of the way. Something to point out, if for some reason, heaven forbid, the transfer is not successful, typically they wait until you stop all medications, wait until your next menstrual cycle, and you start those medications again. You do not, if it's with the same family, you do not have to redo legal, and you typically do not have to redo medical clearance. You just need a baseline checkup to evaluate that you're ready again for those medications. But it is our hope that you have a successful, positive journey. So it is a big decision, but you do change lives. So we hope it's a rewarding journey, and we're here to make it stress-free and as positive as possible. Send us any questions that you have, and we look forward to helping you on this journey.